Hello everyone, I'm Dr. Maunica, Consultant Reproductive Medicine working at Ferty9 Hospital, LB Nagar, Hyderabad. Today I would like to bring awareness about Rare Diseases Day. So as we know, many diseases have a day in a year which is dedicated to bring awareness about the disease, about its transmission and about the risk factors that are involved. Similarly, we also have a day which is dedicated to the rare diseases, and that is the last day of February every year. In leap years, it is 29th of February, and in the other years, it is 28th of February. Now, what is the significance or what is the relation between Rare Diseases Day and my profession, that is infertility? Now, any disease which is occurring in less than 5 people in a 10,000 population can be called a rare disease. When we look up the list of all these rare diseases, we have found that more than 70 to 80% of these rare diseases are actually genetic in origin. So if it is genetic in origin, it definitely has some connection to my forte, which is reproductive medicine. In reproductive medicine, when couples come for treatment, we have different kind of treatments that we offer them, which can be ovulation induction, IUI treatment, or even an IVF treatment. Now, in case of an IVF treatment, which is in vitro fertilization or the test tube baby, which is in a common language, here the embryo is being made in the laboratory by injecting the sperm into the egg. Now, once the embryo is made, the embryo will be transferred into the uterus of the wife at a suitable time. In this interim period when the embryo is with us, we can subject the embryo to testing, which is called as pre-implantation genetic testing. And we do perform this testing to see how the genetics of the embryo are. Normally or ideally, if it is a girl, it has to be 46XX, and if it is a boy, it needs to be 46XY. If the PGT results or the embryo testing genetic results, if they deviate from this normal, then we immediately discard the embryo and we do not go ahead with the transfer. Apart from this, when you talk about rare diseases, now the rare diseases are not as simple as just looking at what the genetic chromosomal makeup is, which is 46XX or XY. They are much more detailed. There could be some problems or some alterations in single genes, there could be translocations, there could be inversions. So as long as we know if there is some disease which is running in any of your families, or you have already had kids with similar genetic issues and you are panicking at the fact that you might again have another child having the same issue. So in that case, we can help, because if you go through the treatment of IVF and form embryos, the embryo can be subjected to testing for that particular genetic locus if it is also carrying the same abnormal genome. And if at all it does carry the same abnormal gene, then we are going to discard that embryo and not go ahead with the transfer. So this will avoid the risk of further miscarriages and also avoid the trauma that the wife has to go through if at all she does end up in a pregnancy with an abnormal embryo. And that's why it is so important to understand that what these rare diseases are, how there is a genetic origin, and how infertility or reproductive medicine will help you couples in this aspect. Any of you, if you are having these issues which are genetic in relation, you are having repeated miscarriages, or you have had pregnancies in a baby who's having some genetic issues, some kids who have actually expired in their young age because of this genetic concerns, then please do approach a fertility center which is nearest to your home and take counseling as to what the infertility treatment can offer you in order to not see the same fate again in your next pregnancy. Thank you.